Good morning, everybody. My name's Reed Broughton. I'm the 2025 Montgomery County Chamber of Commerce Board Chair. On behalf of the entire Board of Directors, we would like to welcome you to our May Eggs and Issues on Healthcare and Emergency Services. Our program will end at 9:30, and we'll have opportunities for questions toward the end of the program around 9:20. To get us started, I'd like to introduce Leslie Robertson to the podium.
Good morning, everybody. Isn't it a beautiful spring day today? My name is Leslie Robertson, and I'm honored to be here today, and I am unfortunately unable to actually present the scholarship to the recipient, Gracie Connor, who attends Christiansburg High School, but I'm here because my dear friend, Mary Tuttle, has this memorial scholarship, and her brother, John Tuttle, was kind enough to allow me to present that award or that scholarship today. I'd like to tell you a little bit about my friend Mary. And please forgive me as I might have a moment or two, as she was very special to us here at Virginia Tech. We were roommates at East Eggleston, and we called her May-Wee because she loved to travel. She often went to France, and she was a yes girl. Let's do it. She was always ready to do it. She was a proud Hokie. She attended many football games, but even more so, she was a leader in every aspect of her business life. In this way, she was a leader all the way to the end while she battled her battle with cancer. She lived up Prosum, and she would be proud that someone of Gracie's caliber and leadership qualities is receiving this award. I'm just sorry Gracie couldn't be here. Thank you for letting me come today to tell you a little bit about my friend, and also to let you know that this scholarship is for women and students that want to enter into the business world. So thank you for your time today, and I hope you have a very good day. At this time, I'd like Sarah to come on up. Have a great day.
Great. Good morning, everybody. I'm Sarah Tavener. I'm the COO at LewisGale Montgomery, and thank you all for the time this morning to talk to you a bit about what Montgomery means to this community, and really just to highlight a few things here. And really, as we'll talk through this panel, emergency preparedness is something that really doesn't happen by accident. It involves a lot of training, a lot of thinking through what could eventually come before it actually comes to eventuality. And what you see here, we call these mission moments. It's really highlighting a great story and really why we do what we do every day. What you see here is a recent recognition event that we did with the town of Christiansburg at their town hall. And this was a patient who ended up becoming a patient. He was actually at the Christiansburg Recreation Center. And just, really the grace of God and a fortunate happenstance, you have people who are trained in life-saving interventions around you, and including a cardiologist, who, when he dropped from a cardiac arrest, were able to immediately intervene. And this is a situation where every second matters. So you're able to stabilize somebody who obviously you did not go there anticipating to see that. But because of your training, you were able to intervene. And really through CPR, they're able to stabilize him, make it so that EMS is able to get on site, take him by ambulance to LewisGale Montgomery. We really have a great, great outcome. And you actually see this patient picture here weeks after this, which, needless to say, could go very differently if you don't have that emergency preparedness and mindset, and if you don't have that training in advance. So really something that we always try to highlight within the community. If there's an interest in training, we're happy to help partner there. So really wanted to highlight that here. Bear with me. Another piece that we want to highlight, and actually today marks our 6-month anniversary for the Christiansburg ER, which we opened on November 1st, and in that time we have already served more than 6,200 patients, which even from what we anticipated is significantly more. It really speaks to how important access to care is, especially within every community, but certainly within ours, where we know that your choices are limited, and we want to make sure that we're able to deliver outstanding care. So incredibly proud of a team, and actually we have several representatives from our emergency services team here, and also with Robert at our panel. But we've got really a great team that we hear from a patient experience perspective, also from our throughput metrics. So when you think through how quickly, if you're coming in for emergency care, how quickly do you get seen? And what we're seeing at the Christiansburg ER is that the entirety of your care is typically done in less than 93 minutes. And when you think through how quickly that is, that you're coming in, you're immediately seeing somebody, you're getting back with a fantastic team, that's really something we're incredibly proud of. And we can't do that without the wonderful people that are in this room with us today. And then highlighting a few additional pieces of technology that we've brought on to LewisGale Montgomery. The first is this Mako robot. And so what this is through partnership with Dr. Bird, who's part of Ortho Virginia, he really helped us spearhead the need here. And so what you're gonna do is if you're going in for a knee or a hip replacement, you're actually gonna meet with them in advance, you're gonna have a CT performed, and they're gonna sit down with the Stryker team who actually makes the Mako robot, and they're gonna make a customized surgery plan specific to your knee or hip. And what that's gonna mean is that when you're actually in the procedure, and that's what you can see at the bottom here, you're gonna see unique to your knee or hip what is actually your body's formation, and they're gonna carve it specific to you. So rather than kind of having this one-size-fits-all mentality, you're truly gonna have something that's unique to you and really see those outcomes shine there. So we've already, since going live with this on November 4th, we've already completed more than 65 procedures, so very excited to see him continue to do great things, and that actually his partners are looking to come on board as well. So very excited to offer this technology. And then keeping the technology train running. We also have Dr. Voltic, who joined us in August with Ortho Virginia. He is an orthopedic spine surgeon. And we brought online the Globus robot. So we're actually the first in Southwest Virginia to have this technology. And what you're gonna do is actually, as you're coming in for a spine procedure, they're gonna bring in what they call a portable C-arm. So it's actually X-ray imaging. It's gonna go around you as a patient in real time. They're gonna look at what is your actual bone structure, what is your actual tissue structure, and how do we make this as minimally invasive as possible to, again, come to the best outcome possible. And then finally, our ENT surgeons, and so this is Dr. Cundiff, who helped us really spearhead this technology. If you think through sleep apnea, I'm sure each of us in this room knows somebody who's afflicted with it. It's actually incredibly common. So more than 30 million people in the United States have this. That's more than 10% of the population. And so as you know, or likely have heard, CPAPs are a big part of treating that condition. And needless to say, very uncomfortable, not something everybody's gonna want to do as a part of a treatment pathway. So instead of doing a CPAP machine, what you're actually able to do is this alternate technology called Inspire. And so it's actually placing a device that's gonna coordinate with this phone app that you see here. And as you go, I'm going to bed tonight, you set the app. This is actually gonna send light pulses to do exactly what your CPAP would do, but without that actual apparatus on you. So it's really been great technology that we've been able to bring to the community. Incredibly proud to have these physicians and this technology in the community. But thank you for your time today. And then now I will introduce Beverly Hill, who is the Public Health Emergency Coordinator for the New River Health District. She represents the Virginia Department of Health's Office of Emergency Preparedness for Montgomery, Pulaski, Giles, and Floyd counties, and the city of Radford. Prior to joining VDH, Beverly served in multiple roles related to disaster preparedness and emergency response in public health, including an academic appointment at the University of South Florida Center for Biological Defense as a member of a research team studying formal and informal volunteer responses to hurricane impacts on the Florida Gulf Coast. So please help me in joining Beverly to the podium. Thank you.
Good morning, everyone. How are you? I would first like to say thank you to Sarah. This is the first time we've had the opportunity to meet, and on that note, public health is not just health department outreach, right? We have a lot of different services that we do provide through our local health departments in each of the localities across the New River, but we also connect very closely with healthcare centers, medical centers, and with our local emergency management officials. And so we truly try to come from a whole community approach where we offer our support as a coordinating or supporting agency. So that just gives a little bit of insight to why they asked me to come today and to be able to introduce and have some meaningful conversation with 4 of our key partners here. If we could take just a moment, starting with Mary Kathryn, do you mind introducing yourself and the organization that you represent?
How's it sound? Okay. Good morning, everybody. I'm Kathryn. I am the regional coordinator for the Southwest Virginia Healthcare Coalition.
Good morning, everyone. I'm Rodney Fultz. I'm the Senior Director of Quality and Operations at Carilion River Valley Medical Center.
Good morning. My name is Geary. I'm the Fire and EMS Chief here in Montgomery County.
Morning, folks. Robert Heins. I'm a registered nurse paramedic, and I'm the Emergency Preparedness Coordinator for LewisGale, Montgomery.
Thank you so much. And Robert, since you're still holding the microphone,
Okay.
in about one minute or 2 minute, your best elevator speech, can you just tell us a little bit about your organization and how it serves the New River Valley?
Sure. And I'm going to go a little bit off the party line. You know, we have an official motto, and my actual motto is "I live here," right? And my neighbors live here, and we care for each other. And our goal is to be as prepared as we can to take care of each other. And part of that stick is I work with all of these people. Right? We don't have competitors in healthcare and preparedness. We have team members that get paychecks from other people.
You know what he said.
I live here too. Obviously, that's a huge reason for why we do what we do. Is we want to serve the community to the best of our ability because it could be our family that's in need. But here with Montgomery County Fire and EMS, our goal is to provide the highest level emergency medical response and fire response to our community. And we work hand in hand with our volunteer partners here in the county to make sure that across the board that we're providing our citizens and visitors a high quality service.
This is getting tougher each level. Yeah, what those guys said. I will say, as a healthcare system serving the New River Valley, and as a citizen of the New River Valley, I'm very appreciative of the services that we have available from both healthcare systems. Both LewisGale, Montgomery, and Carilion New River Valley Medical Center, from an emergency services standpoint, are accredited level 3 trauma centers, which is about, I think there's only maybe 6 in the state at the level 3. There's a smaller number of level 1s. Which the level 1 facility being in Roanoke and Salem is level 2, right? So from an emergency services standpoint and a citizen of the region, we are blessed with access that a lot of other regions of the state would be envious of, particularly in a more rural area. So from that standpoint, I would say, I would echo what Bunny said. We are local healthcare providers serving the local community. And the resources that are available collectively is something to be proud and thankful of, both as a provider, proud of, and as a citizen, thankful for.
Hello, I'm a little different. I do live here. I do also live here, so I can echo that. However, my program is federally funded. We are funded through the Administration for Strategic Preparedness and Response. Every state across the nation can receive these funds. It goes through what they call the Hospital Preparedness Program. There's 62 recipients of that, so states, larger cities, and some territories. But the way each state manages those funds is very different. So in Virginia, they come through what we call the Virginia Healthcare Emergency Management Program. That is a partnership between the Virginia Department of Health and the Virginia Hospital and Healthcare Association. So they form our program, and those funds are then distributed to each of the regions. There are 4 Healthcare Coalition regions within the state of Virginia. So I get to run and work in the Southwest Virginia Healthcare Coalition region. Our regions merged a few years ago, so we have some previous branding names that you may be familiar with, the near and the far Southwest. We are now the Southwest, and we serve 29 counties and 10 cities from Lee County to Amherst County. So I get to reside and live in Montgomery County as well, and it is a joy to be able to do this. Our team of 7 lives throughout each of those localities, and we have 2 office locations in Roanoke and Abingdon. Oh, and we help healthcare prepare for, respond to, and recover from disasters. It's a bit of an anomaly, and as we go through the questions, you'll get to learn the how on that. But we like to say when we met one coalition, we met one coalition. We do get to partner with everybody on this panel and those of you in this room for planning and preparedness as well.
Thank you for that. I can vouch for what she just said, especially in recent times during our collective response to Hurricane Helene and to the winter storms. We sat on coordination calls daily every day, talking about where the needs were, where the strengths were, and what we could do better to work together on that day and the coming days to be able to serve our community. So it's a great organization. Thank you. So the next question, can you share an example from your respective organizations when an emergency response was required and how your team came to the rescue?
Okay, I guess I'll start and go back down the line. So we do a lot of preparedness. We like Blue Skies Days. We work with healthcare organizations to talk about the bad days when it's not a bad day so that they have the resilience they need on that bad day when it comes. Our coalition did experience Hurricane Helene. We were impacted within our region, so that is more of a response. We do mostly coordination. We let local responders do a lot of the response, but we do provide that support to healthcare facilities. So not only hospitals, long-term care, home care, and hospice. And so for us, I would say Hurricane Helene was pretty impactful. The day Hurricane Helene came into the region was Thursday, September 26th. We were actually doing an exercise in Abingdon. And so we had a full room of first responders, emergency managers, and we were talking through that day. And then slowly as the day went on, people started to leave because issues arose. Throughout that time, our organization responded 24/7, 365 for about 3 weeks straight. I have 7 folks on my team. Throughout the state, we have some additional support so that we were able to call on those resources as well. In a span, we operate a dispatch for healthcare facilities so they can pick up a line and call similar to 911, but it's not an emergency response. It's more for coordination and resources. In a year, we typically manage 15 to 30 calls depending on what those situations are. In Hurricane Helene, we managed 30 calls in 3 weeks. And so for us, it was a repetitive situation, kind of back to back. And it was a variety of resource requests that came in from people who needed support for water resources, power resources, communications resources. So as an organization, we have a bunch of stuff. And I can talk a little bit later about our grant and how the program has changed over the years. But we do manage quite a bit of stuff in 2 warehouses in Abingdon and Salem. And so we were kind of moving quite a bit of stuff and really got to see the effects of how hospitals operated. There's a light on the hill during a disaster, and unfortunately do not get to close. And so they had the opportunity to serve a lot of different people. And so providing that support, whether it was non-acute support for people that maybe needed just power resources, trying to make sure that we were helping them manage that influx of people. So I'd say that would be probably one of our most recent experiences.
I think Mary Kathryn touched upon it from a hospital perspective, and Bunny could probably speak to this as well. You just, pick your emergency situation. We call it a Tuesday right around the hospital. These are run-of-the-mill things that everyone in the community expects, that the hospital is there and the hospital has adequate resources and will respond. It's not been too long ago that there were no emergency management plans in long-term care settings and skilled nursing facilities, and their plan was just evacuate to the hospital, just take the patients to the hospital. So from a planning perspective, there's been a lot of work done, facilitated largely by the Healthcare Coalition, to expand the emergency planning, emergency management services into other environments of care. So the flood, if we have shooting in the local vicinity, all those things, right, the hospital is the constant. And so I would say from the standpoint of how has the hospital ever responded and sort of come to the rescue, so to speak, would reach back to the pandemic in terms of the actual, where New River Valley specifically as a facility has had to stretch. And boy, did we have to stretch. We really had to reinvent a lot of systems within the building, care processes, and come up with new ways to take care of patients, because the types of patients change dramatically and the volumes of patients change dramatically. One of the unsung heroes, at least for us from a healthcare perspective, was our facilities team. You don't really think about that in terms of being a healthcare hero, so to speak, but at one point, we actually had to re-engineer and re-pipe our oxygen delivery system in the building because of how much oxygen we were using for patient care during the pandemic. And so in terms of a group that was coming to the rescue, so to speak, that's a group that you don't really think of necessarily beyond the care providers. But hospitals, as you said, are the light on the hill, so to speak, and emergency management coordinators, preparedness folks within the hospital, like Robert, are the people that keep us there in terms of the response and being able to continue to serve the community regardless of what the situation may be.
So we're a little bit different. We're responding to dozens of emergencies every day, so it's something that we're very well trained and well versed in. When you look at Montgomery County, we run about 14,000 fire and EMS calls a year, and that spreads our resources pretty thin, as you can imagine. And here in the county, we have 5 fire departments and 6 different EMS agencies. And so from my organization's standpoint, we're a small part of a much bigger picture, but we all work together incredibly well to provide a high quality service to our citizens. From an emergency management standpoint, that's much more infrequent. Here most recently, one of the emergencies that was kind of bigger picture that we responded to was the nitric acid spill over at the Radford Arsenal. But you look at ice storms, Hurricane Helene, there's things that go on throughout the year that really, test the system as a whole. And so we're constantly trying to find new ways and better ways to make sure that when that next emergency does come, that we can provide that service to our citizens and to our visitors, because we never know what's around the corner. And so we're always training to make sure that we're as best prepared as we can to serve our citizens and our community members.
In my stance on this, right? Hospitals don't have disasters. Your disaster is my Tuesday. And I have to remember that it's your disaster, because to me, I'm just at work, right? So that is a message that we give staff all of the time, right? I know you're having a good time, you're with your coworkers. Remember, it is the patient's worst day, right? So that's our Tuesday. But to get to Tuesday, a huge swath of staff at the hospital prepare for what if our worst day happened? What if we lost power again? I would prefer not to do that, right? What if we lost potable water again? Thank you, Mary Kathryn, for bringing me the ability to wash hands, right? And we work together as a community to handle those things, right? Early COVID, the New River Valley stood up a task force called the COVID Task Force, New River Valley COVID Task Force. Healthcare didn't start that. That was started by Christiansburg and Blacksburg's police chiefs who decided they needed to protect healthcare. And then we got on board as healthcare systems and EMS agencies and worked together and did things we weren't used to doing that were actual response, right? I went out and vaccinated people in nursing homes. That's not part of my job, right? That's part of her job. But they didn't have the manpower to do that, and we did. And I think that might be the best example of emergency response that really the panel has, right? As we got together as a community and worked through a huge problem.
Thank you for those responses. I think that all of you in your own way touched on the fact that while we focus on response, we also always have to be thinking about good planning. And good planning for any organization means having a sound emergency operations or emergency response plan in place. So on that note, while we all understand that there are both successes and failures in any emergency response situation, are there places in your emergency response plans that are working particularly well?
LewisGale Montgomery stresses our surge plan regularly. A super influx of patients, right? That is a thing that all hospitals are required to have, is rarely used by most hospitals. And my hospital uses 8 to 12 times a year because there's a football stadium right there. And my emergency room has 18 beds and 6 or 7 hall beds. And 2019, the first football game, there were 48 patients in my department. And we had a plan for that, and a scheme for that, and staff for that, and an ability to manage that because we knew it was going to happen. And to be frank, most of us on the panel and some of the people in the room, including Andrew Marnick, are planning to use that plan next Wednesday.
Does everybody know what's happening next Wednesday?
So I'm obviously very proud of all of our first responders here in Montgomery County. You know, from volunteers to career staff, we have a really good group that is constantly working together to make sure that we're providing that service that, you know, I've talked about a lot. When it comes to, you know, what we're doing well, one of the common themes that I hear throughout the state is, I'm not going to name any names, but you know, there are organizations that have a really hard time working together because personalities don't mesh, and that's one thing we don't have here. You know, COVID was a great example of that, but there's been numerous situations here throughout the county where we're calling on organizations to help bring in resources that we may not have access to directly, and when that emergency comes in, I can call Robert, I can call Rodney, I can call Mary Kathryn. There's a whole laundry list of people that we have access to that have the resources that we need to respond to incidents. We all work together well, we're all friends. I mean, it helps when that emergency comes that you can call somebody and you're on a first name basis and you don't have to worry that they're just going to shut you down and tell you no, because we're here for the community. There's never a situation where we're picking teeth to try and get what we need to make sure that the citizens and visitors have what they need. So that's something that I'm really proud of, is we have just a great team here that is really dedicated to the community and to working well together.
Yeah, I think something that COVID taught us is that the healthcare system really needs to be a functioning system of systems. That's a lot of using the word system, but if you get what I'm saying, the Carilion system is organized in a way that we can work together, and the LewisGale system is organized in a way that it can work well together. But for the region, the system needs to incorporate and function together as one healthcare system serving the region. And from the state level, the Virginia Hospital and Healthcare Association has put a lot of effort towards that in terms of growing the system capability to manage 4 populations. And I would say that's one of the things that collectively we are getting better at. Yesterday there was a statewide surge drill that we all participated in for all things civil unrest. It was going to drive our collective number of patients coming to us. And we were exercising our surge plans within the hospital. And so if we were tasked with taking 14 patients in the matter of 30 minutes coming from downtown Radford, how would we manage that? And so they experienced the same test at Montgomery. And all the hospitals around the state did that. And we were doing it in a coordinated fashion, that there was a collective response, because services that Giles Community Hospital, as an example, they have available to them may not meet all the needs of their patients, and therefore what patients did they receive at Giles that needed to come to another facility at a higher level. And so we were coordinating and collaborating during the surge drill. So that's an example of the system of systems maturing to serve the public.
All right, let's see here. So we're a little unique in that we do have what we call a regional healthcare emergency operations plan, but it is kind of an all-encompassing plan because every locality, every organization within that county or area has their own plans. So our plan, the way we operate at the Healthcare Coalition, is kind of an overview and a guide on how internal operations happen for us versus external operations, because they need those plans to succeed in what they're doing. So as they all mentioned, we did have the opportunity to do an exercise yesterday, so to test an influx of patients with we have 32 hospitals within our region, and they all received an influx of patients yesterday. And so on the inside of what we were doing, we were operating that from a regional coordination standpoint. So we took calls that were incoming when they had too many resources that they couldn't handle, or excuse me, not enough resources, and we were able to provide those as well. But we also operated a simulation center. So we had emergency management in there, we had public health in there, and we had people calling the hospitals, giving them a bunch of patients from these civil unrest events that were happening. So the way to enhance plans is to exercise them and to kind of talk through those. We do this on a small scale, we can do this on a large scale, but that helps you improve. Regionally, we had some gaps in our regional plan. We bought a bunch of cool stuff right before Halloween happened, those of which were Starlinks. We were adding to our communications cache equipment, but we hadn't operationalized those yet. They were kind of sitting very nicely in neat boxes, and some of the conversations we were having, I had things, do you have the people who know how to do the things? Yes, we've got that. And so we were able to get them to where they needed to, but now we're looking back and saying, okay, how could we have utilized those resources better? What could we have put into our plans to make that move quicker? Could we have sent them out ahead of time? And so looking at some of those areas we're looking at and how to improve those plans. So there are conversations that are regularly happening where we want to improve and we work to improve, but there are really great pieces within the plans that allow you to succeed from day to day.
Thank you for that. Clearly, you all are doing amazing things in your organization when it comes to both planning and response. But Mary Kathryn, you just touched on something that we all do have to face when we're thinking about our plans, when we're updating our plans, and particularly following either an exercise or a real-world event where we all come together as people who are in the response, and we do what is called a hot wash. That happens at the very, excuse me, at the very end, where everybody that's there right then gives some quick feedback. And then we take that information back and we include that in our official after-action reports. So that being said, when we learn about our deficiencies and our gaps, where are there deficits in your emergency response plans? And what resources would help you turn those weaknesses into strengths?
Yep, so as Beverly mentioned, we did do an after-action after Hurricane Helene. That was just finished and published, and we did have some deficiencies in our response. It was focused on the way the coalition operated with its partners, knowing that each person that was involved would be creating their own documentation in response to that. And so we found some areas, one of which was operationalizing just communication assets. The state, through the Virginia Department of Emergency Management, has some really great resources. And so partnering with other agencies in that to kind of better enhance our operations regionally is an option. We had a little bit of gaps on amount of stuff, so we did pull some resources from other coalitions. We coordinated with North Carolina, Tennessee, West Virginia, and Kentucky during Helene for a bunch of resources. And so looking at where our gaps were in Virginia and how we can further enhance those, whether it's utilizing internal resources to the state or just procuring and building up our cache here in the region. And then some of the other things that we're always working to improve are communication, the way we communicate, not the devices we use, but the way we communicate. As you all know, during a disaster or even just a stressful event, communication gets blurred. And it is the number one topic that comes up in most conversations following any event. And so just looking at ways how we can improve that communication moving forward.
Yeah, I think you just hit on it. In a stressful situation, in an emergency situation, communication can get blurry. For us particularly, events that involve some level of security response, whether it be a shooting or something that's somewhat proximal, somewhat close to the hospital, those are hard events because you're not really sure what's happening in real time. The patient care part is easy. We do that all day long from a hospital standpoint, but the coordination and having clear communication around an evolving event is very difficult. And so within Carilion, we have a fully accredited independent police agency. And they work very well with Montgomery County, with Radford City, and the other jurisdictions all around, but you just really don't know what's developing in real time. And so compounding that for us, if you've been to the medical center, you know that it's not exactly like just you go in one door and you're in the hospital. We have 14 main entrances around the building if you've been there. So it's a very different experience to close the door going into the pulmonology office and the sleep lab than it is the main entrance. And so security events are challenging for us. We have a plan, but my goodness, how quickly can we really implement the plan? We have the ability to lock the doors if we have to go there, and we can do that immediately. But that significantly disrupts operations and sometimes can create some collateral events in and to themselves. So for us, because of some unique components of our plan, security events are really ones that of the type we really have to be on our game.
So my answer is going to be a little bit different, not tied directly to emergency response plans, but I'd say one of the biggest issues that we're facing here in Montgomery County, and honestly nationwide, is the decline in volunteers. And historically in Montgomery County, we've relied on volunteers to provide our fire and EMS services. And the whole reason that my organization exists is because we don't have the volunteers that we had 10, 20, 30 years ago. And we're working as hard as we can to try and address that and try and find new ways to bring in and attract new volunteers. But the truth is that they're just not there anymore. All of the social pressures, the family life, the work-life balance, it's making it incredibly difficult for people to find time to serve their communities in the way that they did years ago. We have some great volunteers here in the room that are still very dedicated to their community, and those are the ones that we're trying to keep and protect because we need that response. The best thing about a volunteer workforce is when you have that huge emergency, that's your flex. That's your additional staff. Now, I can't call 10 of my staff members in today and say, hey, we have this big thing going on, can you come? Well, no, they're not working. They're at home with their families, but with the volunteers, you get that flex. You can call on them at a moment's notice. As soon as they get that notification, they're there. And I'll give an example of that. About 2 years ago, we had a wreck on the bypass right here in Blacksburg that involved 2 daycare vans from Giles County that were unfortunately involved in an accident. And we had upwards of probably 30 pediatric patients right here on the bypass. And we're calling resources in from across the county, but Blacksburg Rescue had 6 ambulances on the road in less than 10 minutes. And that's not something you get with a career organization. You know, you may be able to call in some additional help, but you're not going to get the resources like you get with volunteer organizations. And so we're trying to address some of those shortfalls, but again, it's nationwide, and I don't think anybody's found the answer yet. And when it comes to a career fire and EMS department, as many of you all may know, it's incredibly expensive. Here in Montgomery County, and for this group in particular, we push this all the time, more growth, more growth, more growth. But at what point are you stressing the system to a point that it can't handle it anymore? We're not there yet, but you know, we could be. And especially if we lose more of our volunteers here, we could be in a situation where, you know, the citizens, our visitors, are waiting much longer than they need to get that emergency response. So it's a challenge that we're facing. You know, we're not alone in it by any stretch of the imagination, but nobody has the right answer yet, and so we're trying to hopefully be the first ones to do. But it's definitely a challenge.
Before I talk about my gap, I will continue to be a volunteer paramedic because it's a habit. I'm 20 years in. Leslie over there is 20 years in. Andrew Marinek, who is over here, is 15 or 16 years in? 19, right? It's a thing we do. You get up, you put on your boots every day, you put a pager on your belt or your phone, because I get call notifications on my iPhone now. And sometimes you park your kid at the station with the secretary and you go on a call and you're like, hey, I'm gonna come back later, right? My 2 girls called Blacksburg Rescue Station Rainey's house, because that is the previous secretary's name, and they thought she lived there. And she babysat my kids. So the volunteers will continue to exist, and I think we do find it. Gap-wise, the biggest emergency planning gap for my hospital is probably hazardous material decon. It is hard to convince a nurse these days, put on a rubber suit and an air pack and go wash methyl ethyl off somebody, right? I do it. Somebody convinced me I should. I've been to the federal training center for it. I'm allowed to teach people, and I do. And it's hard to convince them. And it's hard to have enough people at a hospital my size or New River's size on a team to do it. There are roughly 350 employees at my hospital. You should have about 50 people on the decon team, so for an event, 25 show up. That's a sixth of my staff. That's just not going to happen. Our current gap closure on that is if New River has a problem or Giles has a problem, Tammy Turpin, who is the emergency planner for those facilities, calls me, and we go, and Pulaski goes. And if we have a problem, I call her, and her people come. And we have a solid, little bit more than a handshake agreement that we're going to do that. And that's the gap closure, right? And I'm probably going to call Blacksburg Fire Department, and I'm maybe going to call Christiansburg Fire Department, right? Hey, can you come help with this? And we know each other, not just by name, but by face, right? We go to events with each other. Mayor Nick, who's on the fire department, and my big kid are best friends. So like I get to talk emergency management over the back of my truck with him, right? And that's, I think, is the best part of this valley, is that we have personal relationships with each other. And that's how we're solving a lot of the problems.
Thank you. So you both touched on a very important topic, which is volunteers in emergency response. And I don't know how many of you were actually here during the COVID response, but we do have a very robust volunteer cadre called the Medical Reserve Corps. They fall under VEH from ASPR's grant to us. And these are people that are both medically credentialed and also non-medically credentialed to provide what we call general support. Before I came here with the previous coordinator, I think New River had around 250 Medical Reserve Corps volunteers, but they weren't all very active. COVID happened, and that number shot right up to somewhere around 1,200. So people that were able to help, that had medical credentials, that could do something, literally came and said, put me to work. And so during the response, they were doing everything from supporting our epidemiology team to do contact tracing, to get out into communities to provide PPE or personal protective equipment, and actually doing the vaccines and the testing at the drive-through sites that were set up in partnership with our key people and organizations across New River. So when I came here, that was actually my first role. I was the Medical Reserve Corps coordinator. And I saw and learned firsthand how instrumental these individuals are. So that being said, do you use or utilize volunteers to support your efforts in times of emergency response in each of your organizations?
Sure. This has kind of needed to happen. Last real time was April 16th, that we actually utilized volunteers. There are volunteers in my hospital all the time. They greet people, they show people around. But actual medical care provided by a volunteer is allowed for in my emergency plan. And the Joint Commission, who's the accrediting body for most hospitals, and CMS, who funds most hospitals, allow for emergency credentialing of medical staff. If Michael Geary walks into my hospital and I've declared it a disaster, I'm allowed to go. I know he's an EMT, and for 24 hours, he can work on my work. And that's written into our plans.
We use volunteers every day, and it's just the nature of what we do. Here, like I said, we have 5 fire departments and 6 different EMS agencies, and the majority of those are still almost totally volunteer. I think countywide, including the few at Blacksburg and a few in Christiansburg, there may be 75 total full-time employees in the fire and EMS system here in the county, and the rest of that is volunteers. We have over 250 volunteers that are still actively running calls here in Montgomery County. from, firefighters, paramedics, EMTs, all the way down the line. And we're very fortunate that, we do draw quite a few volunteers from Virginia Tech, and they come in, they're not here for very long, so you've got to take that time to train them and get them up to speed. But, having that resource here right in our, back pocket is really helpful. But yeah, we use volunteers all the time to respond to emergencies, and they're as trained and as professional as any of the career staff that we have in this county.
We also have similar processes as Montgomery. We would look to the Medical Reserve Corps as well for a source of volunteers in the event of an emergency. I think regionally, our Medical Reserve Corps is quite unique in relation to other areas of the state, again, because the culture of the area. And one of the very unique attributes of having the university community in our greater community, and the desire to serve from that population really gives us an opportunity to tap a large number of volunteers that other areas just do not have.
We use volunteers indirectly, so we're a conduit for resources, so we want to know where the volunteer agencies are across the region and what type of volunteer work they do. We can also provide training opportunities for those volunteers, so if they do need the emergency credentialing, if they need additional resources, we partner with those organizations. We also utilized volunteers yesterday during that exercise that we did. We used students, they were nursing program students, and the hospitals coordinated with them, and they had them moulaged up from a protest event. And so we utilize knowing where those resources are, and we can utilize students in that as well for that.
Great, thank you so much. So on the flip side, we depend on both volunteers and career paid staff to run our organizations. Who are the emergency preparedness and response champions in your organization? Whether it's disaster planning, response, prevention, preparedness, mitigation, or recovery, who are the key people that are the mountain movers?
So we, like most in this group, will maybe mention this, but we operate off of an incident command system structure. And without going too in-depth, it is a structure that allows agencies to coordinate, build up, and respond during an emergency incident. And so for us, that looks a little differently. I'm not always the one in charge during those bad days to allow people who know a little bit more about a specific incident to respond. So we do have a coordinating structure. There are 7 folks on our team. And then we also have a structure that we utilize within the areas. So if a situation's happening within one county, we coordinate with that local emergency manager and make sure that they are tied in for local response. And so I'd say, we like to say all disasters start and end local. And so making sure we know who the folks are that are responding within that locality so we can tie individuals together. It does take a whole community to work through an incident. And so making sure we're putting the right pieces together. So on our side, we have leadership in the VDH side of the house, the VHHA side of the house, that provides support to our program, and then the other coalitions around the state.
Same with the incident command structure. Tammy Turpin is our emergency management planner for New River Valley and also Giles. Christy Hall, who's our Senior Director of Nursing, she is always our incident commander if she is available, making decisions in the best interest of patient care. And I typically provide the planning seat and management of planning activities and resource procurement. From an incident command perspective, we also will engage with, again, Carilion system incident command if it is activated, as well as making calls across this table. Our first call, if we have an incident in our coming into our emergency department, or we have a local incident, our first call is to Montgomery's ED to let them know situational awareness, and then we will escalate the communication to the appropriate places.
From an emergency response standpoint, there's no one person. It's never an individual approach. It's a team effort. When it comes to the planning and preparedness here in Montgomery County, our Deputy Chief of Fire and Emergency Management is Tyler Hall. So in the background, he's the one that's preparing for the next emergency and making sure that we're as well prepared as we can be. But when it comes to actual emergency response, he'll be overwhelmed if it's just him, and he is very well aware of that. So when we do have the hurricane leans and the power outages and the water outages, it's a big team response, and we make sure that we have everybody on board that we can to, again, serve our community.
My job as an emergency preparedness coordinator at a hospital is to have thought of all the bad things, right? And have a scheme and approach in place so that I can let my leaders lead and they can lean on me, right? I act as a subject matter expert. And it allows my leaders to do what they need to do, be forward-facing, solving problems, and they can call me or my fellow paranoid people and go, where would I get this, right? My partner in paranoia is a county volunteer who's the director of clinical operations at my hospital. She's a registered nurse and a hazmat technician, married to a Christiansburg firefighter who also works for Michael Geary, right? Because it's a big feeling community that's actually pretty small. And we meet before any bad things happen. I met with her yesterday about football. After we get done here, I am liable to go meet with her again about Metallica. You know, we try not to create a person that's the expert though, because if I'm the only guy that knows the plan and I go down, the whole system goes down, and that's not a great approach.
That's the beauty of having a very strong emergency preparedness and response community. That whole community approach is so important. What exciting new initiatives or services related to emergency preparedness, response, mitigation, and or recovery are happening or on the horizon within your organization?
Regularly, I teach decon. Maybe every other year, I get to go down to Anniston, Alabama. FEMA offers what I will call graduate level emergency preparedness education down there at the Center for Domestic Preparedness. Last year, I went down there for highly infectious disease, which is code for what do you do if you get an Ebola patient at your hospital. So we did some planning and prep for that. I'm not sure what I'll do the next time. From a community standpoint, because I do happen to be a volunteer paramedic at Blacksburg Rescue, Blacksburg Rescue is one of the 4 cave rescue teams on the East Coast of America. There's one in New York, there's one in northern Alabama, there's one in the middle of Tennessee, and most of the middle Atlantic is covered by Blacksburg Rescue volunteers.
So there's a lot that's changed within our organization over the past few years. To give some perspective, 4 years ago, Montgomery County Fire EMS was 1 person, and thanks to our board of supervisors and our county administrators, soon we'll have 50 full-time employees, and that's all out of the needs of our community. And one of the things that I'll highlight though that is last year our board made the investment to hire a training chief that's responsible for training all of our career and volunteer firefighters in Montgomery County, and he is also the Blacksburg Volunteer Fire Chief, so he wears multiple hats. But he built a very robust training program with the Blacksburg Volunteer Fire Department, and when we hired him last year, he brought that training program to all of Montgomery County. So we're providing training to all of our career staff, all of the volunteers that historically they may have had access to through the state, but it's very few and far between that the state's able to provide all that training. So he's working with several of his volunteers and some of our career staff to make sure that all of those classes are at an arm's reach for our volunteers and our career staff here.
Yeah, I kind of chuckled about the question because nothing in emergency preparedness is exciting. It's usually what can they come up with next to scare the hell out of you. lately emergency preparedness isn't about the big wreck on the interstate anymore. It's about cybersecurity, civil unrest, mass events that are not your normal emergencies that you think about. And so sometimes in combination with one another as you're drilling. So it's not what it used to be, I would say.
That's a good way to put it. I don't know. I feel like all of us at this table, and you probably have someone in your organization who likes to talk about the what ifs. What if this, what if that, what if that? They'd be good on your emergency planning team, because it is an anomaly to talk about a disaster on a good day when you get excited about, ooh, let's put this here and let's test this element. Yeah, let's push some people through a methyl bad stuff day and see where it lands. So I feel like there are some exciting things on the horizon, but for us, it is a little uncertain. We do have some changes on a state level and also a federal level. If you all have been paying attention to the news, we are federally funded. So our program has been in existence since 2001 due to a few things on the national scale, anthrax and 9/11. And we realized as a nation we needed to be better prepared to support the healthcare system as a whole. And so at the time we bought a bunch of stuff, and that's where we were at. We were in the stuff game for a while. Right before COVID, we were headed out of the stuff because we realized it takes more than stuff to help people prepare. It takes training and exercise and relationships. And so we were focusing our efforts on that. COVID hit, we became a stuff conduit again, and so we are looking at managing that. So I'd say things on the horizon that we have some shifts in what our program's gonna look like, if it will exist, and where that structure gets reallocated. So I am hopeful because the work that is being done, even locally, regionally, and statewide, is exciting to see come to fruition, even if you just provided that training. We're nationally accredited through the National Disaster Life Support Foundation within our program. We deploy across Virginia, but to other states to provide courses through Augusta, Georgia, and people can receive those accreditations. And so training is where that's at. You can see that light bulb moment cut on, and then they can bring that back to your organization. So I'd say training is what's exciting coming up.
Excellent responses. Just to wrap up, I just want to say a huge thank you to all of you. It's a pleasure to be in your company. I'm proud to be part of such a strong and robust and friendly group of people. Truly anything that I've encountered in my time in this position, which has been almost 2 years now, everybody at this table or one of their representatives has simply been a text or a phone call away. And I can't tell you as a relatively new person to the area how comforting that is. So I think all of you should feel proud too and feel confident that you have the right people in the right places to make sure that this community stays safe, healthy, and that we have the ability to thrive going forward, especially in times of disasters and emergency response. Thank you for being here today.
Thank you to our panelists, our moderator. Thank you for your service to the community especially. And thank you to our sponsor, LewisGale Montgomery. Thanks to all of you for coming. Our next event is June 5th, or our next breakfast is June 5th. We have many, many other events. But hope you all have a great day. Thank you all.